Hi, everybody. Welcome. We're on week 2 of community health nursing. This is going to be a week really where we focus on family and the school nurse and how family dynamics can work and change. So we're going to start with chapter 20 as our first chapter that we're going to take a look at. And when we are doing our introduction, we know that our family health nursing is practiced in all settings. We know that our trend is to move more to community settings, and family nursing is an area that has a strong base. So this is going to provide an overview of family nursing, what it really looks like. So when we have our nurses working with our families and other members of our health teams, this is how we are going to ensure that everyone is involved and that their health care is being taken care of. So public health nurses need skills that are going to work with not just the individuals, but their families. We're going to bridge relationships between family, community legislation, influence policies, and protect the health of populations. So the definition, as we know, of family has changed dramatically over time. Not necessarily is it always going to be a man and a woman and a child, or 2 men or 2 women, or 2 women and 2 children. So we don't really know. And when we go into a family, we don't know who exactly we're going to be encountering when we do. So we want to make sure that we are involving families in our care, coping with health problems within the family, and collaborate with our families to use interventions that may be successful. We use the link between family and services that a member or members needs. They must be aware, as nurses, we must be aware of our own values and attitudes and be very culturally open to different family structures and contexts. Know that we need excellent communication and negotiation skills. We will talk throughout this course about biases, and this is where it comes in. Your opinion on how a family dynamic works is not really going to matter, but what does matter is that you understand that dynamic and you are able to accommodate and help with that. So when we look at our family functions, there's many different functions of the family. We have economic, reproductive, socialization, affective, which is like our feeling function, and our healthcare function. So make sure we're looking at our families with each family member, the family as a whole, and then how do they relate to society. So we look at the individuals that compose the family, the relationships between them, interactions between the family members, and social systems. Sometimes when you go into a home, there'll be many family members that are in the home, either visiting or live there. And so you want to see how is that interaction and what do they find as a healthy or unhealthy dynamic. There is a box in your book that I'd like you to look at. It's healthy versus unhealthy. And what that really stresses, the book stresses, is that time together, valuable for families to develop. And so we want to look at spending time together as a family and how that dynamic works. So know that our family health is always changing. Families are neither good nor bad. We know that healthy, balanced, functional, or dysfunctional families, 21, box 20.2 is the box I just told you about. I want you to know that description of our healthy families. When we look at approaches to family nursing, we have family as a context or structure where it puts the place on the individual as the center and then the family surrounding it. And so then we look at family as a client, and there we're dealing with the family in the center and individuals that are second. And then we have family, which is as it's seen as a system where it focuses on the family as the client, and the family is viewed as interacting with one another. And so it's more like individual members in the family as a whole. And then component of society, we see how families are seen with their institutions along with health, education, and religion. We have different theories that we look at with family nursing theory, family systems, ecological system as well. We take a look at our genetics and our human genome project, which showed us that there was many genetic tests and that have implications for families. This is important for us as nurses to know so that we can help determine and do a genogram with them, which is where you plot out the different health conditions they have and how they all interact. You can also do an eco map with them, and that's going to be environmentally, how does everyone work? So we're going to watch a little video in a minute about our eco maps. When we're looking at our families for healthy outcomes, we're looking for data collection, determining where to meet the family, make the appointment, make sure you're planning for your safety. stay by a door, let your people know when you're going to someone's home. You see anything unsafe, you leave. Don't wear a ton of makeup or jewelry that's going to really be uncomfortable. When we interview the family, we're going to look for definition of the problem and designing our interventions. We know that we've had some policy changes like the family medical leave. 1993 gave authority for people to leave their job unpaid and to care for themselves or a family member. We have Social Security and temporary assistance, that's to needy families. School immunizations laws are Medicaid and Medicare again. We spoke about a little bit last week. And then we have our Affordable Care Act in 2010. With our Healthy People 2030 focusing on family nursing, it emphasizes our individual and community issues. Take a look at our Healthy People 2030 box in chapter 20 as well. We're going to watch a little movie about how you do an eco map. So let me share that with you. And then this is another way you can work with your communities and do a genogram. So here we go.
Family level. Oh.
I'm sorry, I just want to make it so that we can all hear it.
Okay. So I'm going to put a triangle right in the center, and this is your family. So tell me how you define your family.
Okay, it would be my husband Scott,
Okay.
myself,
Okay.
big sister Cece, and little brother Ethan.
Okay. So now just think about, from your family triangle, outside, what are some supports that you have? And think about them really broadly. Just kind of brainstorm.
Well, I think it's important to do, for at least us, another triangle.
Great.
Outside of it, that would be another level of family.
Okay. Great. So you kind of see it over here?
Yeah, or even, I see it actually
Bigger in the-
encompassing. Yeah.
Awesome. Let's do that. Okay. So tell me, who would that be?
That would be extended family, which would include my side of my mom.
Okay.
Do you want all aunts, uncles listed?
However
or-
you want. It's for you. This is really your record to kind of help you think
Okay.
about who's involved.
So 2 of my sisters
Okay.
would be Pam and Bonnie.
Okay.
2 brothers would be Jeff and Charles.
Okay.
And then it would be on this side, let's do Scott's, that would be his dad,
Mm-hmm.
sister.
Yeah.
So that would be Wendy,
Wendy. Okay.
John,
Okay.
Kelly.
Okay.
I think that's probably good for extended. I mean, I could definitely go bigger than that, but that would probably be my immediate extended triangle of who I would
Great.
go towards
So-
as a support.
So you're a big support. So now we've thought about your immediate family and kind of your extended family, your triangle of life. What other supports are out there, things that surround your family?
That surround me would be, I'm in grad school,
Uh-huh.
so that would be a strong support in that I am in the field of education and intervention.
Yep.
So for my son needing supports, that's been huge at Kent.
Mm-hmm.
And then along with that, I would say, trying to think. Church is a big one.
Mm-hmm.
Great. Work's not necessarily a support for my husband in terms of emotional, but definitely that financial piece.
Great.
He works at Timken.
Yep.
Work for me as far as family as well as financial would be at Life Center Plus.
Alrighty, so that was just a little video that we had on EcoMap. Sorry for the background. The woman's children in that were playing or making noise. But anyway, so that just shows you a way that you could do an eco map. You talk to them about the things that are important to them in their lives and what's going on and how to make that eco map. So then we take a look here at our next chapter, which is going to be family health risks. So we really look at that and we look at our family as promoting the health of the individual as well as the health of the community. We're going to take a look at family health risks. So the health of the family, historically, we focus on the fact of illness, and the role of the family and the cause of the disease and the use of services. In the health of the nation, we have a limited attention has been given to family health risks and the role of society. So something we want to make stronger for us. When we look at our concepts in family health history, we have family health as a condition, including the promotion and maintenance of medical, mental, physical, spiritual, and social health. We have our health risks, the factors that are going to determine whether we get disease or not. Our health appraisal, which is going to be identifying characteristics of health and comparing them with the standard age group, health risk reduction, application of selected interventions, and then life event risks. We're going to look at age-related risks to a person's health as they go along and transition. The model that focuses on family wellness in the face of change is our Newman system model. When a life event is big enough to contract the flexible line of our protective defenses and it breaks through our line, we feel some stress. The degree of wellness is going to be determined by how much energy it takes for us as families to become stable. And we look at the 5 factors that will play there: psychological, physical, sociocultural, developmental, and spiritual. And our health risks are things that are going to determine whether or not we are going to have a health concern. Control of health risks is done through disease prevention, family health risk appraisal, and health risk reduction in family crisis. Most of our major family health risks in nursing intervention, we have our inherited biological risks. So as we get older, we have some things that we're more likely to get: our genetics, transition, and our genogram. That's going to, when we're going to look at our genetics of our families and see who has what and how will that impact us. We look at our environmental risks, or social, economical, and environmental risk assessment. They worked on an eco map in that video, and it's really what are our factors that are involving in our environment that are impacting us. And then we have our behavioral lifestyle risks. So we know things like smoking, drinking, things like that. When we look at home visits, remember, we're going to have several different phases of them. And we're going to make sure we establish why we're coming so that the family knows what our purpose is and we don't just show up. We have our initiation, pre-visit, in-home, termination, and post-visit. When we contract with families, we're going to make sure we begin identifying ourselves, identifying what we're doing. We're going to be working with them, and then we're going to be terminating. And then we empower families. The whole goal here is to make the families be empowered and able to take care of their person who they need to. We have a group of people that we always look at that are going to be our vulnerable populations that are going to be at risk. This is our LGBTQ community. We have those that have same-sex marriages are going to be at risk for family dynamics. We need to be careful that we are not looking at them with our traditional family view. And our teenage families, our teenage parent families are going through their own stresses aside and beyond trying to make their families work. So with community resources, we have many things we can do. We have our Medicare and our Medicaid. We have food stamps. We have WIC for single or low-income women and children. We have our state and health insurance programs. We have our American Heart. We have American Lung. We do telehealth. Our Family Medical Leave Act, again, we see here as something that can help with our community. And we're going to look and find our resources so that we can share information, make sure we're preparing for them and making initial contact, arranging transport. Important when we're working with families to know that not everyone is at the same educational level. So be careful with things that you're sharing as far as reading materials and language, if we have a language barrier, if we're being sensitive to that. So that takes us to our next chapter, which I'm going to share with you now, and that will be chapter 22, which is going to take a look at our health risks as we go across the lifespan. So when we look at our introduction, we're going to look at children, adolescents, adults, older adults, and selected at-risk or vulnerable populations once again. So children and health, major public health issues we see as obesity is a big one. With our school-age kids, we're going to have injuries and accidents. And we're going to look for abuse, of course, and across all of ours. With our infants, we worry about SIDS, and we look at chronic health conditions, try to minimize those. So when we try to target these younger kids, we're going to be working on primary prevention, where we're going to be preventing these things from occurring. So we're going to teach them, do our educating on smoking, nutrition, immunizations, more so with mom and dad, and environmental health hazards, such as our big one for kids is going to be lead. So you're going to watch for the lead in those homes that kids may get their hands on. When we look at our different health and regulation as related to adults, we have our American Disabilities Act that was put into effect. We have our Family Medical Leave, and we have our Older American Act, which was all have come in since after the 1950s, where we were looking at making sure that we are equal with our care across the board. And so when we're looking at ethical and legal issues with older adults, our number one concern with our older adults is going to be abuse and neglect. We do have a National Center on Elder Abuse. When we're helping our older adults, we want them to make sure that they're making their own decisions and disclose information to them so they can understand. Level of care is on basis of function, and termination and treatment at the end of life is something we'll look at with hospice and home care, but something to think about. So our big one with our older adults is going to be abuse. Chronic diseases with our management of adults focuses on healing rather than curing. So you were going to develop self-management skills, chronic care, like with our hypertensions or diabetics, manage disease effectively, boost the healing ability, prevent complications, deterioration and decline. Our health status indicators that we're going to look at with our chronic diseases are cardiovascular, hypertension, stroke, diabetes, mental illness, cancer, weight control. Chronic health conditions, we look at women. Our biggest concern with women, adult women, is going to be our eating disorders, more common in men than women. We see this, so we're going to be sensitive to diets with our middle-aged women. Reproductive health, gestational diabetes, breast cancer, osteoporosis. 2 of those can be done with our screening and our secondary prevention for breast cancer and osteoporosis. When we look at men, we really have less participation in healthcare with women than we do with our men, and we see some cancers that are unique. There's an area that we don't hit upon in these slideshows, which I will talk to you about, and that is adolescence. What kind of things we're going to talk about with adolescents is going to be our concerns with drugs, violence, dating. They see a large rise in dating violence in our adolescent population and violence among relationships. That hasn't been proven as to why. It's just something that we keep an eye out. So we're going to be very open and in our communication about risks and abuse. So we look at health disparities among our special groups, and that's going to be our adults with physical and mental illnesses, our frail elderly, LGBTQ group, and our incarcerated adults, which are going to be in our prisons. So when we look at our community care settings, we have several for adults. We have senior centers, we have adult daycare centers, we have assisted living, long-term care and rehab, and home health and hospice. So this is how we overlap into that adult community so that we can serve them in the best way that we can. All right, and our last section that we're going to take a look at is going to be school nursing. And this is something very special to me because, like I've shared with you guys, I have done school nursing for several years now. So no, in the 1800s in England, we saw the start of school nursing, and there's been several federal legislations in education and in healthcare. So we have that No Child Left Behind of 2001, where no child can be not moved forward unless there's reason for that. We have our individual healthcare plans, which is plans that we create so that students with any medical needs like ADHD, like diabetes, anything, is not impacting their education. Then our IEPs are for the kids that need some extra teaching due to specified learning disabilities or other. We have the National Association of School Nurses, which is great guidelines and support for all nurses. It gives us standards of practice and what we can do. Know that school nurses should be registered through the state board. They need a bachelor's degree in nursing. You can also get the national certification for school nursing. And there's really no general laws, but it is recommended, American Academy of Pediatrics, that they are registered nurses and that they do have their bachelor's degree. So in the role of a school nurse, we give comprehensive nursing care. We coordinate health education programs in the school, consult with school officials, and coordinate the health care of many students in their schools with their health care that children receive from their own health care provider. So we do lots of things as school nurses: direct caregiver, health educator, manager, consultant, counselor, outreach, and researcher. CDC has our healthy school initiative, so whole school, whole community, whole child model. And with this, it's everything is involved. So we're coordinating the school, the community, and the child for success in education. Something to remember with school nursing is that they have found that students who are out of school due to medical concerns are not as successful as those that are helped with the school nurse to accommodate and learn how to function. So we look at our Healthy People 2030, several objectives with immunizations and keeping kids in school with chronic illnesses. We want to make sure that that happens. We look at our preventions in school, our primary, secondary, and tertiary, and these are important again. We see primary prevention in school. What we're going to be doing is we're going to be educating. We're going to help prevent childhood injuries best we can with our playgrounds. We're going to be careful with school sports, substance abuse prevention, and vaccinations is going to be our primary because that's going to prevent our illnesses. We take a look at our secondary prevention in the schools, like nursing care for emergencies. We give medication in school. We screen for lice. We screen for scoliosis. We're screening for child abuse and neglect, and for violence in school and at the home. And then with our prevention in school, this is once we have a condition. So we're going to have our kids with asthma, allergies, diabetes, autism, ADHD, special needs. And we have homebound children who aren't able to make it in the school. So school nurses will help to involve them in the education process. And pregnant teenagers and teenage moms, key there is that we keep them in school, because we do know that they need to get their education and they will have less health disparities and better living if possible. Controversies that we see in school nursing, I see all the time: birth control education. Big thing in where I am is they don't want it to be discussed in school. No protective techniques given. So we're not allowed to give the birth control to students. And sex education and reproductive screenings is a fine line, but something that school nurses deal with. When we look at ethics in school nursing, you must be able to work with the situation, and if you need help, you always refer to other healthcare providers. We see some trends going on in school nursing. Healthcare is increasing, lots more things being done, tube feedings, changing of diapers, things like that. You see all that now going on in schools. We have online resources, and we have the framework for 21st century school nursing practice in our National Association of School Nursing. School nursing is one of those community field nursing, and what we make sure we do with those is be the advocate, get everyone involved, and do your very best to have family involved. That's your best case scenario. Please review your Healthy People 2030 objectives for school nursing as well. See you this week. Take care.